Hey, Dr. Alan Christianson here with you. So what do your Hashimoto's test results mean? You've got these back, you were told you have it, you're wondering if you have it. Let's talk it out. Let's talk through and make sense of it. Okay, so first up, there'll be the TSH scores. Now, TSH is thyroid stimulating hormone, and it's your pituitary gland telling your thyroid to release hormone. Now, this is backward. Have you ever heard about opposite day? TSH works only on opposite day. So the higher it is, the more your thyroid is sluggish. And the lower it is, the more there's too much thyroid hormone. Now the TSH can get really high. It can get a couple hundred, or even higher. It can only get so low, like 0.01. You'll never see negative numbers on that. So there's a point at where if you get more and more thyroid hormone, the TSH shuts down, and you can get a lot more hormone above that. You can take more and more and more and more and more, but it can't go any lower. And when it's higher than somewhere around 7 or 10, there's not always a direct relationship from one number to the next, meaning that a 50 is not clearly better than a 70, or a 12 is not clearly worse than a 7. When it's up above those ranges, it's kind of like a yell. And there may not be a clear difference between a loud yell and a really loud yell. So yeah, the numbers are not always that linear when they get up. We think about healthy people having TSH scores between about 0.4 and 1.9. Now that differs if you're pregnant, if you're over 65, if you've got heart disease, if you're very young. So yeah, we're talking about adults that are not pregnant and no cardiac disease and not seniors, but that's a healthy range for them to be at. So if you're somewhere above that, even if you're normal, that can be a sign that the thyroid is slowing down. Next up, we've got the thyroid antibodies. We've got a couple of those. We've got anti-thyroglobulin, or anti-big T, little g for short, and then anti-thyroid peroxidase, or anti-TPO. Now, these are antibodies that are attacking structures of the thyroid. Structures, not a good word. I wanted a word to categorize them both in. So one is a protein, one is an enzyme. Chemicals within the thyroid, constituents could work. Oh well. So thyroglobulin is the template on which thyroid hormones are built. And thyroid peroxidase is an enzyme that activates iodine and makes it single and ready to mingle, ready to attach to thyroglobulin. And these can come under immune attack. So when these are there, they confirm that there is an autoimmune attack present. Super important point. If these are not there, if your antibody results are negative, or if they're below a normal range, that does not rule out Hashimoto's. You can have Hashimoto's and negative thyroid antibodies. Super important, but they are relevant. Now, when they're very high, they may be factors causing symptoms. They may also affect the risk of heart disease, and they can also change the risk of disease progression. So they are worth being aware of, and if they're extremely high, they can be important for some to track. Next up, we think about the free hormones, the T3 and T4. Sometimes you'll see just something that says T4 and not free T4. Well, that's the same as total T4. And it's not bad, but it's a little less accurate because some T4 is active and some T4 is inactive, and total just shows both. And sometimes the amount of active you wouldn't guess based upon the total. So in most cases, we prefer the free T4. T3, similar story. There are some cases more so relevant to Graves' disease or hyperthyroidism from other causes in which we like total T3. But normally free T3 is the preferred for that as well. Now these are how much hormone is in circulation. And I think about this kind of like there's the gas in the gas tank and the gas in the gas lines, right? So the gas lines aren't out of gas until the tank is empty. Your gas lines won't have half as much gas when you're driving on half a tank of gas, if that makes sense. And it's kind of like that with the TSH and your free hormones. So your TSH can get higher as you get hypothyroid, but the free hormones won't get lower right away. Only when the body can no longer keep up will they then reflect. So they're helpful things to have, but there are very rare circumstances in which they change the big picture. In most cases, you're seeing what's happening based on the TSH, and once you consider its optimal ranges, the free hormones don't change all that much. There are those who argue that despite the TSH, you need to have the free hormones on the high side of normal. And I understand the thought process behind that. Healthy people do have a low TSH, and with a superficial understanding, you could think that therefore they would also have a high level of T3 or T4, but they just don't. And that goes back to the gas lines versus the gas tank thing. You know, a full tank doesn't mean you've got too much gas in your gas lines, nor does a quarter of a tank. You know, a quarter of a tank, you've got plenty of gas in your gas lines until you're empty. And it's the same way for the free hormones and the TSH. The TSH is the gas tank. It's showing it first. Now, we also think about a marker called thyroglobulin. This is not the same as anti-thyroglobulin antibodies. This is a protein in the thyroid cells. And as thyroid cells die, their contents spill into your bloodstream, and those proteins circulate. So thyroglobulin is proportionate to the number of cells dying. Now, that sounds scary, but some is normal. There will always be some cells that are old and some baby cells that are ready to take their place. That's just the circle of life in the jungle of the thyroid. But when they're really high, we know there's too many cells dying. And that can be from an enlarged thyroid. You know, goiter can cause that. Thyroid cancer can cause that. So it's a marker of thyroid inflammation and the cell turnover rate. And then we've also got the ultrasound. Now, these are underused, but I'm a real big fan of those. These help know whether or not the structure of your thyroid is a problem. And you get some sense of this through a doctor's exam, but not as good, you know, and not as direct and as measurable. So these are important. If you've not had one, you should. And if you have had one and it showed abnormalities, it should be tracked. It should be followed up on. So all super important things. Now, a big point is that your test results will only be meaningful if they're done in a way to get accurate data. And it's very easy to do in ways to have your data fluctuate. You know, many things affect how your thyroid works and how it works in a given moment. So if you test consistently, the results will be useful. You have a solid comparison. You know, a silly example, imagine that you wanted to know how tall someone was over the course of 6th grade, 7th grade, 8th grade. And let's say you forgot to tell them that they need to be standing up when their height is measured. And maybe one time they were kneeling, one time they were sitting down, one time they were standing up. Yeah, let's just say that they did their first height measurement and they were standing in 6th grade, okay? Now in 7th grade, they were kneeling when they had their height measured. And then in 8th grade, they were sitting down when their height was measured. You could look at that and say, oh wow, they got shorter every year. Well, no, they didn't. They just didn't test in a consistent fashion, right? So here's how that applies to your thyroid. Your thyroid fluctuates throughout the day, your TSH scores especially. So your TSH between 7 to 9 in the morning is not the same as it would be 10 in the morning, noon, afternoon. So you've got to check the same time of day to get a consistent result. Now, medications are a big factor. They especially affect your free hormones. If you check your free hormones within the hours after taking your medicine, you could be pretty much anywhere. For the next 12 hours, there's a big distribution, and it's not predictable where you would be within that. But you wouldn't be at your baseline. So those are really calibrated to be done before you've taken your pill. Supplements. So supplements that contain biotin, probiotics, a few other things as well, they can throw off your thyroid scores. Now, I'm not saying they hurt your thyroid or they cause harm to how your body uses thyroid hormones, but they goof up the test results. And that can even be the case for days later. So 3 days before your thyroid test, stop taking all supplements. You'll get cleaner results from that. Women with regular menstrual cycles. There's a compound called thyroid binding globulin, and it's a normal protein, and how much you make is a function of how much estrogen is in your circulation. If you're a woman having menstrual cycles, the amount of estrogen in circulation is very different during your period as it is right after ovulation. So it changes. So you want to be consistent. The worst time to check is the middle of your cycle. The best time to check is the first week, roughly, like days 1 through 9, day 1 being the first day of real flow, or the very end of the cycle, like days 21 through 28. So those are good times to check. Mid-cycle, days 10 through 20, you can have very random fluctuating levels. And the last thing is fasting. So whether you just had a meal and how your blood sugar is playing out, that'll also change your thyroid scores. So to get consistent results, to really compare apples to apples, test to test, you want to know if what you're doing is helping. You go on the thyroid reset diet. You want to see if you're getting better or not. Well, you've got to have a fair comparison. You change a medication, you add a supplement. You want a fair comparison. You don't want to measure height standing versus height sitting. You want to see if you're growing. You want to get a good accurate reading. So check in the morning, before you eat, before you take your pill. Skip your supplements 3 days beforehand. Make sure that you're in that first 9 days or last 7 days of your menstrual cycle. And also make sure that you've timed it properly in those ways. They're all critical. So do those well, and you'll get consistent results. And now you'll know what those results mean and their relevance. All right, Dr. C with you. Take great care. I'll see you again real soon. Bye-bye.